Today, we're going to demystify one of the most sophisticated procedures out there, the modern facelift. We're going to peel back the layers, and yeah, that pun is intended, to see how top surgeons have totally transformed it. It's no longer a simple skin pull. It's become a deep architectural restoration of the face.
So let's start with the image that probably pops into your head. When you hear facelift, do you picture that kind of tight, windswept look? You know the one. For a long time, that was a very real possibility. But today, the entire philosophy, the whole approach, has changed. Let's dig into how. Here's our roadmap for this explainer. First, we're going to look under the skin at the face's real foundation. Then, we'll get into the different surgical techniques. After that, we'll walk through the entire journey, what the recovery is really like, and finally, answer the big question: how long does it all last?
All right, let's get right into it. Now, to understand a modern facelift, you have to do something that sounds a little weird. You have to forget about the skin for a minute. The real magic, the part that creates that truly natural, long-lasting result, happens way deeper in the support system underneath it all. This right here is the single biggest shift in the game. The old way, it was all about skin tension. You'd pull the skin tight, and that's what created that unnatural look that, frankly, didn't last very long. Today's best surgeons are more like architects. They go deep. They rebuild the foundational layers of the face first, which creates a result that looks both incredibly natural and is built to last.
And the key to all of this comes down to one structure, the SMAS. Yeah, it's a mouthful. It stands for a superficial musculo-aponeurotic system. But here's what you need to know. Think of it like a strong, fibrous net that connects your facial muscles right up to your skin. When we're young, that net is nice and tight. But over time, that SMAS layer loosens up, and that is what causes the jowls, the sagging, and those deep facial folds.
And that's exactly why the scaffolding analogy is so perfect. I mean, think about it. If a builder just paints over a crumbling wall, it's not going to hold up, right? It's the same idea here. If a surgeon only tightens the surface, the skin, the weak structure underneath is just going to sag again. But by rebuilding the scaffold, that SMAS layer, the face's youthful shape is restored from deep inside. The skin then just gets to drape naturally over that new, stronger foundation.
Okay, so now we know the SMAS is the all-important target. But how do surgeons actually work on it? Well, there isn't just one way. Let's look at the different tools in the toolbox, because this is absolutely not a one-size-fits-all situation.
This table breaks it down beautifully. At the very top, you've got the deep plane lift. This is the big one, the most comprehensive approach. The surgeon actually works under the SMAS, lifting the whole facial structure as one single unit. That's why it lasts so long. A classic SMAS lift, on the other hand, works on top of that layer, using careful folds or trims to tighten it up. And for those first signs of aging, a mini lift offers a less invasive tune-up. The right choice depends entirely on a person's unique anatomy and what they're hoping to achieve.
And this quote, this really nails the modern philosophy. The goal is not to make someone look like a different person. It's about restoring their own unique facial harmony. It's about turning back the clock so you look like a fresher, more rested version of yourself without losing the very expressions that make you you. So what does this whole journey actually look like for a patient? It's a process that is just defined by incredible precision. And believe me, it starts way before anyone ever steps into an operating room.
The whole thing really unfolds in 4 key stages. First, that personalized plan. Super detailed, sometimes using photo simulations so everyone's on the exact same page. Then, the incisions, which are a true art form, designed to be hidden in the natural creases of your face so they're basically invisible later on. Step 3, that's the heart of the operation, repositioning the deep SMAS layer. And finally, the closure. Now this isn't just simple stitching, it's an advanced, multi-level technique that puts all the tension deep inside. That lets the skin close beautifully without any pull, and that is the secret to avoiding obvious scarring.
The surgical skill is absolutely incredible, but that's really only half the story. The recovery is just as critical for that final result. So let's map out what that healing timeline actually looks like. Okay, here's a realistic look at the healing process. Those first 48 hours, that's when swelling is at its peak and rest is everything. After about 1 to 2 weeks, the sutures come out and you can start easing back into life. The big milestone for most people is that 1 to 3 month mark. That's when the majority of the swelling is gone
and you feel, socially ready. But, and this is so important, patience is key. The true, final, settled result quietly emerges over the next 6 to 12 months, as every single layer of tissue finds its new, permanent home.
So a facelift can turn back the clock by a decade, maybe even more. But of course, the aging process itself doesn't just stop. So the key question becomes, how long do the results actually hold up? And what can you do to protect that investment?
For a state-of-the-art deep plane facelift, the results are seriously impressive. We are talking about 12 to 15 years, and the reason it's so durable is because it's a true structural reset. But that number isn't set in stone.
Because the longevity of the result is really a partnership. The surgeon's work is the foundation, no doubt, but your lifestyle choices are huge. Things like being diligent with sunscreen, SPF 50+ is non-negotiable, maintaining a stable weight, and of course not smoking can dramatically extend the life of your lift. You have to think of it like protecting an investment. Good skincare and maybe some non-invasive maintenance treatments can help keep everything looking fresh for years longer.
So let's end on this thought. The modern facelift is this incredible fusion of art and science, right? It's delivering results that are more natural and longer lasting than ever before. But as this technology gets even better at perfecting the art of turning back the clock, it leaves us with a really fascinating question. What does that mean for how we, as a culture, actually value the journey of aging itself?